We're here to defend yourself.
Yeah, I wasn't here to defend myself.
Accurate.
I do want to say thank you to everyone here today. I do think at this juncture we have a quorum. I would welcome all who are in attendance today. Thank you for your interest in the work of the State Board of Education. If there are any news media present, please announce your name and company. Hearing none, is there any objection to approving the minutes as presented? Hearing none, the minutes are approved by unanimous consent. There is, to my knowledge, a change to the agenda. If you would look under the for approval items, this, if I'm not mistaken, should be the second reading from Ms. McClement. I think that is second reading, not first. So bearing that in mind and making the noted change from first to second reading, with that being a change, do I have a motion to approve the minutes as amended?
So moved.
All right, I have a motion by Mr. Walters. Is there a second?
Second.
Thank you, Ms. Delaney Frierson. With that having been said, all in favor of the minutes being, the agenda being approved, please state by saying aye.
Aye.
Aye. Do we have any public comment at this time? Moving right on along. For our approval items, I would like to bring up again, as I said before, I think second reading, Ms. McClement, if she would come up, please, with the State Board Regulation SC Code 243-1 criteria for entry into programs for special education for students with disabilities. If she would come up, please.
Dr. Shields, we may need to move that out.
All right, we'll move that right on out of order. How about we'll just slip that one down and do the electric slide and come back with that one. And we will go with the proposed amendments to the SBE Regulation SC Code Regs 43-80, Operation of Public School Transportation Service, second reading. And I know I've got Philip here. Philip Sees, Director of Office of Governmental Affairs.
Good morning, Chairman and members of the Policy Committee. Thank you all for taking the time this morning to give this some time. So the proposed regulation in front of you is a result of a bill that was introduced for the first time this session. The bill required an aid on every school bus that was transporting a child in a child safety restraint system. The districts came to us with some concerns about the bill. The first one was that since the bill required an aid on the bus, if an aid was not on the bus for whatever reason, whether the district wasn't able to find them to hire, which we're seeing across districts, or an aide called out sick, the bus could not run. And so that would potentially put districts in violation of state and federal statutes and regulations. The second was a substantial fiscal impact to districts. On the high end of that, that number exceeded $4.7 million. So with those two concerns from districts in mind, we approached the legislature about tackling this in a regulation. The regulation before you today is what you passed at the state board meeting in June. So I'm happy to take any questions on that. And then I believe we have an amendment to the reg.
And sir, if you would, just in relation to the amendment to the regs, for clarification, if you would explain that.
Sure.
Because I think what you've done is what districts would want to have happen, and that is, yes, by all means, aids are very important, but sometimes due to financial exigency or absentee, it may be difficult.
Correct. So what the amendment is in front of you, it's the closest we could get. It's a workable solution. We worked with the districts to try and find some language to accomplish the goal of the bill while not restricting them and potentially putting them in violation of federal and state statutes. What it does is it requires an aid on buses with students with child safety restraint systems, but it also gives the option for districts to still run those buses. If not running those buses would put them in violation of state, federal laws and regulations. And that's the main, there's one more item with the amendment. It says student in wheelchair shall be transported on a bus staffed with an aide or other qualified employee who shall operate the wheelchair lift. This is also, there's a statute that requires the bus drivers to stay in the seats of the buses while the bus is running, and the bus has to be running in order for the wheelchair ramp to operate. So this is also just kind of reinforcing what's already in code.
Are there any questions? Ms. Frierson?
Dr.
O'Shields, I don't drink coffee, so that caffeine thing won't work for me. If a child is on a bus and the bus has to run because we don't want to break rules, but there's no one on the bus, how is that child taken care of?
Right, so there are a couple of different ways that aides get on buses. The primary one is if the child's IEP or 504 plan specifies an aide must be on the bus. In that case, an aide has to be on the bus. That's basically comes down from the feds under, I believe, IDEA. And so if a 504 plan or IEP says an aide must be on the bus, then an aide has to be on the bus, full stop. And as far as we're aware, districts are complying with that completely. What this regulation is trying to address is if an aide is not required under a 504 IEP plan, but the child is in a child safety restraint system, what then? And we're saying districts should have an aide on the bus, and if they don't, the buses shouldn't run unless the bus not running would put them in violation.
Okay, I'll go first to Ms. Allison, please.
Mr. Cease, I just want to clarify this in my own mind. If a child has an IEP, the district knows ahead of time that that child has an IEP.
Correct.
And if the IEP calls for it, then they would know ahead of time that they needed someone on the bus.
Yes, ma'am.
The addition is that if they are in a wheelchair restraint, and either way, the bus cannot run unless there is someone on there. If the IEP calls for it, or if the wheelchair
Correct.
restraint.
Yes, and the wheelchair this is nothing new. This is just confirming to what's in statute.
Right, so there's nothing new in this reg.
Other than the fact that we are recommending or requiring that an aide be on the bus with a child safety restraint system. But if there's no aide available, the bus still may run if it would put the district in violation of state or federal statutes or regs.
And that violation brings with it quite a sum of money if they're sued or whatever.
There's a long list of state and federal laws and regulations that they could potentially violate.
Thank you.
And I think we have a question.
Explain a little bit. I read in there where at times a student could act as the aide, that there could.
I'm not aware of that, where that could happen. But that, I just haven't heard of that. Typically, aides are school district employees.
I understand. Was just concerned.
No, I can look into that and get back to you.
Or
I'm not aware of
practice.
that being a district
Okay.
policy.
Good.
Are there any more questions of Mr. Cease?
If I may,
Yes,
Mr. Chair.
Mr.
So
Walters.
basically, it takes out shall and must and makes it if and should,
Yes,
with the exception of five.
should, yes, sir. We're trying to get as close as we can to the original bill while still, taking into account the district's concerns.
And I do think it also reiterates that if it is in the IEP or if it is part of the accommodations and they do have them, then they still have to have them.
Correct.
It's in these other cases, and I get into Mr. Walters' use of the terms, rather than shall and must, it becomes if and should.
Correct.
Yes, sir, Mr. Harrington.
I don't have a question. I'm sorry, I was trying to get the IT's attention.
Well, you got it.
I have
Anything
one more
else?
question.
Yes, ma'am, Miss Allison.
Does this relate to any type of activity bus,
Recycling, I can't get.
athletic bus, and that kind of thing?
This
Or
is-
only actual school buses to and from school?
This is, I believe, any bus transporting students, activity after, if it's a school bus and there's students on it, this relates to that.
Thank you.
Any other questions of Mr. Cease? Thank you very much. This was a delicate situation. I think you handled it very adeptly.
Thank you.
Thank you. We will now move to item 3. I'm looking at my brain. The wizard is looking at his brain. Item 1 is still not here? Okay, okay.
Mr. Chair, I don't think you can put that on the consent agenda. It's got to go on the full agenda because it's a second reading.
That's good. Thank you so much. I am learning, and John Tyler is making notes of what I will do the next time in my improvement plan. Are there any questions as it relates to the proposed amendment by Mr. Cease? Is there now a motion to approve?
Mr. Chair, I move that we would approve putting it on the full agenda for this afternoon's meeting.
All right, Board Member Walters made the motion to approve. Is there a second?
Second.
Board Member Lee, Sally Lee, my favorite chicken liver friend, seconded the motion. All in favor of the motion signify by saying aye. Aye. All opposed by like sign. The motion carries. Thank you for, now we're moving to number 3. Yes, 3. I would have Florence Public School District's 1's request for School of Innovation designation. At first, I would like for parliamentarian John Tyler to come forward, and then we will be followed up with Quincy Moore. This is a change. Jewel Stanley is with us, and we may ask her things just for kicks and giggles. But Quincy Moore is with us today. So first, Mr. Tyler, and then from there, Dr. Moore.
Thank you, Mr. Chair, and assuming that you will be presiding over the full board meeting this afternoon and make a chair report, I would respectfully request that you describe in detail what a chicken liver friend is.
Noted.
Okay, thank you, sir. I could not find that one in Robert's Rules of Order. Section 5919-350 of the South Carolina Code of Laws allows for a local district to seek exemption from certain regulatory and/or statutory requirements under the School of Innovation model. This allows flexibility, which Ms. Moore is going to describe in more detail based on the district's request. The legal process it must go through first is that there must be a public hearing at the local level with a 2/3 vote from the local board. And then it comes before the State Board of Education for a 2/3 vote as well. There are annual reporting requirements imposed upon the school that the school provides to the districts provides to the State Department. And then 3 years out, there's a more substantial, 3 years out from approval, there's a one-time, more substantial report data provided to the State Board of Education to evaluate the efficacy of these exemptions and the progress that it has made and whether it's meeting the goals. So there are certain exemptions that cannot be made. The federal and state laws, constitutional provisions prohibiting discrimination. Those cannot be waived, those cannot be exempt. Health, safety, civil rights, disability rights, those cannot. Minimum student achievement requirements, attendance requirements, and state assessment requirements. And so Ms. Moore is going to present the district's specific request for exemption, but I just wanted to take a moment to cover the statutory vehicle by which these requests come.
Thank you so much. Thank you. Dr. Moore.
Good morning.
Good morning.
Chairman O'Shields and members of the committee. It's my pleasure today to present to you this request from Florence One. I'm not sure if anyone from the district is here, but it is my honor to present this request to you. I know you've had an opportunity to look through your packet of materials, and I'm going to just draw your attention to the synopsis that the department provided for you and kind of just talk you through the request that Florence One is making. So the purpose of this request is the approval of a School of Innovation designation pursuant to South Carolina Code 5919-350 for Florence Public School District 1's School of Innovation in Healthcare. The School of Innovation in Healthcare would be a collaborative partnership with McLeod Health, the region's leading hospital system. And I'm sure you saw in your packet the endorsement letter from the CEO of McLeod Health, speaking to the fact that a lot of our larger employees are facing in need of around 400 employees in this area. And this being then an actuality to try and help fill that gap. The School of Innovation in Healthcare would serve as a career center for up to 350 students in grades 9 through 12 interested in pursuing health care as a career. So on behalf of the district is requesting exemptions from the following requirements. First of all, 43-234, which is an exemption from the 120-hour seat time requirement, would allow students to earn credit by demonstrating proficiency in course content. Regulation 4350 and Regulation 4363, exemption from these requirements would allow the School of Innovation in Healthcare to hire non-certified staff to teach career and technical education courses. And in this way, the School of Innovation of Healthcare would be able to utilize content area or field experience experts to fill limited instructional needs, increase career and technical education opportunities, and expand students' access to authentic learning experiences in the field with community partners. Regulation 43205 is an exemption from administrative and personnel qualification requirements that would allow the School of Innovation of Healthcare to recruit, hire, and contract with well-regarded, high-quality professionals within the healthcare field. And if you couple that with Regulation 43209, the same would go for highly qualified support professionals within the healthcare field. Both of these types of employees would be supported by professionals who obtained a high level of education with high level of education-specific training and are board certified in their individual areas of expertise. Regulation 4370 is an exemption from textbook requirements, which would allow the School of Innovation in Healthcare to pursue project-based learning and real-life career experiences. It would also allow for research in healthcare-specific literature and resources to be utilized within the confines of the innovation. And then finally, an exemption from Code 591425, which is the school start date requirement, which would allow the School of Innovation in Healthcare to follow either a modified calendar as well as to provide a schedule that works around student schedules and community and hospital resources after regularly scheduled work hours. The metrics that Florence One is going to use to track how well this is working is in several areas. Specifically, they're going to track the enrollment in the health science pathways. They're going to track enrollment in health-related career internships. They're going to track student attendance, the earning of health science credentials. And after high school, they're going to track whether the students are entering into college or in a related health science field. Also tracking the hiring by their healthcare partners and retention in these careers after 5 years. And as Mr. Tyler told you, they will be required to come back after a year and report on the progress, and then after 3 years, they would have to reapply if in fact this School of Innovation is working. It's clearly innovative, and I believe in South Carolina and across the nation, we're going to begin to see these kinds of applications simply because of the workforce needs that our state has. So it is my pleasure to present that to you, and I'll do my dead level best to answer any questions that you may have.
As I've read this, it seems to have been vetted both by the McLeod Healthcare System with a listing of high school and 4-year, 2-year degree programs. So some they could work and possibly get like in the billing and all, that they could get training, as well as it was also vetted and unanimously approved by the Florence One School Board.
Yes, sir. And I will tell you, the Office of Educator Services, the Office of Federal and State Accountability, which is where now the Office of Personalized Learning is, the Office of Career and Technical Education and Student Transition Services, will all be working with Florence One to make sure that we are following things like the correct use of the Perkins money and things like that to make sure that this goes exactly as they have intended.
Yes, sir, Mr. Harrington.
Yeah, just being from Florence, I wanted to offer my support as well. Very good presentation. I have talked to the hierarchy at McLeod Medical Center, and I've talked to Jay Hensley, who's the president of MUSC in Florence. Florence has 2 large regional medical centers in McLeod and in MUSC, but also Health South is there, and they've become a regional player and have built facilities in several rural areas, which is helping access for people who are disadvantaged, don't have transportation and that sort of thing. This is not only going to be a training opportunity for these hospitals, but any student that desires a career field in healthcare can take courses there and also prepare themselves for college and get a head start on their career aspirations. The center is designed and will soon be, after it's renovated and all that stuff and the coursework set up, it will be open not only to Florence School District 1 students, but it's going to be a regional. That was required by the legislature in order to get the funding that I think they put up $10 million of this funding. McLeod Health has also put up, I think, has pledged $2 million towards this. And all those 3 major healthcare providers in Florence have made a commitment to use them, not only hire their graduates, but also to provide instructors who are qualified to teach in the special or masters in their particular area. And I've read about the schools of innovation, and I think for what we're looking for, this embodies the kind of thing that we want to support, and I appreciate your considering this.
Thank you, Mr. Harrington, for that endorsement. I appreciate that.
Are there any other questions or observations? Hearing none, is there a motion to approve?
So moved.
Board Member Walters made the motion to approve. Is there a second?
Second.
Second, Board Member Frierson seconded the motion. All in favor of the motion signify by saying aye.
Aye.
Aye. No like signs needed. The motion carries. Back to. Momentary recess. Sure. This may not require action at this point. Therefore, we may entertain a motion to adjourn. Oh, come on, somebody.
So moved.
Thank you. Thank you very much, and thank you, Mr. Tyler. Thank you, Ms. Moore. Do I have a second?
Second.
All right, everybody get up. Time to go when it's almost 9:30, so we made it.
Oh, ready to go the next.